afternoon. Sorry, I've just had a long cabinet meeting, that's why. Okay, I'm going to make a significant health announcement today, and then we'll hear from the Acting Chief Health Officer, the Health Minister. We've got representatives here from the AMA and the Pharmacy Guild, and then we'll move on to other matters after that. Okay, so we've had reports and Cabinet's been briefed today that the flu season we have in Queensland this year is significantly bad, and it's comparable to the flu season we saw in 2017, but we have large number of concerns at the moment because our cases are doubling and escalating quite quickly. So last week we had 1,848 cases of influenza A, and this week we've already got 4,282. We currently have 151 people in hospital with influenza A, and I'm advised 10 are in ICU. So these are numbers of concern, and what we are also very concerned about with this particular influenza A is the impact on young people, so ages 10 to 39. Well, what are we going to do about it? Well, we've taken the step today, and we are offering Queenslanders free flu injections. So starting from tomorrow, you can go to your GP or your pharmacy right across Queensland and you'll be offered a free flu injection up until the 30th of June. Now, why are we doing this? Because we are seeing the impacts on our hospitals, and if we don't get a vaccinated community with the flu vaccine, we are going to see escalating numbers in our hospitals. So we need to do a preemptive strike now. We need to make sure we have this preventative measure in place, and I am encouraging all families in Queensland to please take up this offer of getting a free flu vaccination. Now, the other thing can I say too is I understand there are cost of living pressures out there for families as well. And rather than families sitting at home saying, I can't afford at the moment for my family to go and get a flu vaccine, it is free. So there is really no reason why you can't vaccinate your family. I understand that some families and the community has vaccine fatigue. We've had people who've absolutely done the right thing in this state and gone and got their COVID vaccines. But what we are seeing now is that these symptoms are very similar to COVID. They do have an impact on your lungs and your headaches and everything. I know one of my nieces has been very sick with this, and it's taken a lot longer to get over than like a normal flu. So it is serious, and we don't want to see people ending up in our hospitals when you can take a preventative step and get the vaccine. So look, I'll hand over to the Health Minister and then Dr Aiken, and then we're happy to take some questions. Thanks.
Thank you, Premier. So what we know is there really has not been influenza A circulating around Queensland for the past 5 years. In 2017, when we had a very severe flu outbreak, 2/3 of the cases were influenza A. We are now seeing 98% of our flu cases so far this year are influenza A. We also know influenza A does impact and affect young people as well. We've got some of that data here today, and the Acting Chief Health Officer, Dr Aiken, will talk a little bit more about that. Compared to the 2017 flu season hospital admissions, we are already at the admission rate that we were at the end of July in 2017, which means this is escalating very quickly, and we expect in the next 2 to 3 weeks that our cases will end up at least doubling. So we could end up with hospitalisations well over 400 or 500 hospital admissions, and that won't be the peak. So we do need to make sure we are doing everything possible to protect our economy, to protect businesses, to protect our hospitals and health workers, and most importantly, our community. Businesses have done such an incredible job in very trying times over Christmas and throughout this year with staff shortages from COVID. But now, with the flu season being a flu A, we are going to see a lot of staff shortages with staff being off sick from the flu. And there is one thing that businesses can help us do to address the staff shortage. That is encouraging your staff to get vaccinated. Have a flu program at your workplace. Allow your staff to all go get their flu shot because it is now free. Currently under the National Immunisation Program, everyone from 6 years old to 64 years old, unless you're in the vulnerable group, have to pay to get a flu shot. Well, this year, the Palaszczuk government is providing that flu shot free if you go out and get your vaccine up to the 30th of June. Now, why only the 30th of June? Because we need you to get out and get vaccinated now. Don't wait. These cases are doubling every week, and we know the next 2 to 3 weeks are going to be significant for businesses and also for our hospitals. So we want everyone to come out very quickly. I want to thank the Pharmacy Guild and the AMA Queensland for partnering with us, to our GPs and pharmacists who are doing a great job in immunisation both for COVID and the flu. They're going to be doing even more now because we need lots of people to be coming out and getting their flu jab. Now, we know a lot of people, almost 40% of eligible Queenslanders haven't got their COVID booster, and we know that a lot of children between the ages of 5 and 11 have not had even one COVID shot. You can get a COVID vaccine at the same time as you get your flu vaccine, and they're both free. So please seriously consider that. We have had co-infection of people getting COVID and influenza at the same time, and sadly we have some people in ICU right now with both infections. So we know the most important thing we can do to help our economy, to help businesses and to help our health sector is get the flu vaccination, and now you can get it for free up to the 30th of June, and we strongly encourage everyone to do so.
Thank you. Dr. Aitken?
Thank you, Premier. Thank you, Minister. Flu numbers are doubling every week. You've heard this already from the Premier and the Minister. What we're seeing is that that epi curve resembles the 2017 epi curve, and you've got examples of that there with you. What that means is that we will shortly get a situation where we have increasing numbers of people presenting and needing hospital admission or ICU admission. That's preventable in many ways by increasing our vaccination rates for flu. COVID's a severe disease, but COVID in vaccinated people is a much less severe disease. Flu is the same. Flu can be a severe disease. In an unvaccinated community, it can be worse than COVID. In a vaccinated community, it's able to be managed. It's really important for us that we extend the flu vaccination reach. Currently, for those people between the ages of 6 and 64, it's much harder to access flu vaccination, and our rates are much, much lower. That's also on top of a community that hasn't had exposure to flu A for the last 5 years. 2017 was the last time we had flu exposure. So we've got a community that hasn't got that previous exposure and is under-vaccinated. So again, please, we want everyone to come out and get that flu vaccination to make sure we protect the community, as we've done in COVID, and make sure we're able to continue to provide health services in our community. The numbers that we've got so far coming through are overrepresented in that age group 10 to 39. That's where our predominant cases are, and that's an age group we know has much, much lower rates of vaccination. It's so important that we then work with the GPs, the primary healthcare sector, and the pharmacists, and enormous thanks to their efforts over the weekend to work with us, because it's so important that we utilise that system that's able to be ramped up quickly and safely, and also consolidate the links with people who have existing GPs so they get access to their normal health care, and we work with GPs and pharmacists to do that. So again, I feel like last time I was here was November, December, and I was asking people to please get vaccinated for COVID as we approached the 80% and 90% mark. But now this is flu, and in an unvaccinated community it can be incredibly severe. So please, take an opportunity, get the free flu vaccine, and we look forward to not seeing you in our hospitals. Thank you.
Thank you, Premier, and thank you, Minister, and thank you, Cho. Chris Owen from the Pharmacy Guild, and we'd just like to say thanks to the Premier and for the Minister for coming up with this announcement. We know that over the past 3 years in particular, we've had very little influenza that's been circulating in the communities, and that our vaccination rates have dropped off in 2021 compared to 2020. We look forward to providing those vaccines to the public as of tomorrow, and we strongly encourage people to go visit their GP or their community pharmacy to try and get their vaccination ASAP. So, in summary, I think it's a great announcement, and I think we'll be hopefully getting the curve flattened for influenza, as we did with COVID as well.
Thank you, Premier, Minister, Cho. So 4,000 flu cases, that's an astonishing number. And so AMA Queensland has been talking about the importance of the flu vaccine for the last several weeks, especially in the lead up to this flu season. And those numbers really indicate how important it is for everyone to get vaccinated. After the last 2 years of influenza dormancy due to COVID and the lockdowns with the borders and also in the community, we're really worried about the trajectory that this flu season's heading. The trajectory is similar to 2017, as the Cho said, but also it's quite frightening. And if you are in that age group of 10 to 39 and you haven't been vaccinated, it's important that you get vaccinated. And if you're due for your COVID vaccination, you can have it at the same time. We really urge everyone to make an appointment to see your family doctor or your pharmacist and make sure you do get your flu vaccine as soon as possible. This is a great initiative, and we're really supportive of this vaccine being free for all the community, and we really hope that the community responds. Thank you.
Any questions on this announcement?
What is the fear from the government if not enough people do get vaccinated? Does this mean, public hospitals will be...
Well, we don't want our hospitals overwhelmed. So there's a winter bed strategy that the Minister's been working on, but we are seeing these high numbers now and we're acting decisively now.
What is the current capacity in hospitals in terms of beds?
I'll get the Health Minister to address that.
Are you going to make flu jabs mandatory for, say, aged care visitors?
I think they already are for aged care, is my understanding, yes. Yep.
And will you look at doing flu jabs at COVID vaccines?
At the moment, we are encouraging people to go to their GPs or their pharmacies. That we think that is the best way at the moment. If we then need to supplement by actually going and looking at going into schools, we will look at that like we did with COVID vaccines. But at the moment, that's in the background. Yeah.
Any idea?
We have budgeted up to $40 million. Now, like I said, this is a preventative measure. It is also a cost of living measure for a lot of families out there that are doing it tough. But if we're acting now, you're doing preventative, because we will see, otherwise, if we don't do this now, we will see our hospitals are swamped with people with flu cases. And we don't want that. We want a healthy population.
The people that are in ICU, are they elderly people?
I'll get Dr. Aiken to address that one.
Any idea how the rollout's going in aged care homes, and has Queensland Health been contacted to try to help that?
I'll get the Minister to address that. But can I just urge Queenslanders, so starting from tomorrow, if you have not had your flu vaccine, the Queensland Government is providing free vaccines for you to stop you from getting severe illness. This influenza A is nothing to laugh about. You don't want to see your family members sick with this, and the symptoms are very similar to COVID.
Premier, are you taking this drastic measure because our hospitals are already overswamped?
I'm taking a very decisive, proactive measure now to help stop and prevent the escalation down the track.
Because our hospitals could not cope.
Our hospitals will not be able to cope if we keep seeing this over the coming weeks and months. That's why we're taking this decision today.
Some would argue our hospitals are already not coping.
What I'm saying is our hospitals across the nation are actually experiencing pressures at the moment. That's why we're very keen for the new Prime Minister to put on the National Cabinet health as one of the first face-to-face meetings of the National Cabinet. And I've spoken directly to the Prime Minister about this.
Has the Queensland Government ever funded anything like this before?
I'd have to check. But so basically, the free immunisation program is up to 0 to 6, and then 65 onwards. Correct? Up to 5. Sorry. And we are doing that at 6 to 65, 64. To make sure that Queenslanders get vaccinated.
In terms of the winter bed strategy, are there anything else that you're looking at this year, over and above what's normal because of how under pressure?
Well, I don't recall this has been happened before. This is a very decisive step. to make sure that people have the opportunity, so every Queenslander now has the opportunity to get a free flu vaccine. You've heard from the Chief Health Officer, you've heard from the AMA and the Pharmacy Guild. This is a very serious flu season. You don't want to get it. You don't want your family to be sick. You don't want to see a loved one end up in hospital. So we're encouraging people to please take advantage and get their free flu vaccine. I'll get the Health Minister to respond to a couple of those questions, and then we'll move on to other matters. Is that right?
Thank you.
Yeah.
So yes, we do have, in addition to our normal winter bed strategy, what we have done is we've learnt a lot about COVID over the last 2 years and how to lift up the system very quickly. We still have our contracts in place with our private hospitals, so we aren't utilising all of their beds at the moment for COVID because they're using them for planned care, and we know how important that is, but we have the ability to reach in, and so there's around 625 beds where we can reach into private hospitals, and those meetings are occurring this week with the private hospitals about utilising those for flu demand as well. In addition, and we haven't done this since the 2017, or actually, in fact, we haven't done it since swine flu. We've had acute flu clinics. So we had them a decade ago. These are not dissimilar to the sort of COVID triage facilities we have set up outside of EDs. We can now pivot and use them for flu. So what will happen is we will look at where the demand is, and when people arrive, we can test them before they walk into an ED, and we can get results quite quickly as to whether they not only have COVID, but whether they have influenza A. From there, we'll be able to triage and work out whether they can go home and be cared for at home, including through our virtual hospital, and keep them out of EDs and hospitals and out of hospital beds. So we're looking at that strategy as well. We know that strategy worked very well when it was used before, and we know we've got these great facilities outside of our EDs to be able to do that. Importantly, our GPs are going to be critical here because our GPs will be asking them to also test for influenza A, so they can be finding out if their patients have influenza A and give them advice as to whether they can go home and just be cared for at home or whether they need to be in hospital. So those are just some of the strategies. The most important strategy that can make the biggest difference is flu vaccination. So that's what we want. And everything we learnt through COVID, good hand hygiene, and staying home if you're sick, because we know if people are going into the workforce with influenza A, it will spread quickly, especially through an unvaccinated workforce. So that's what we're wanting people to do. And of course, most people are still carrying around a mask in their handbags or their cars. If you feel like you need to, then pop one of those on if you start showing symptoms as well. That's just a recommendation, but we know these things work.
So you've got 100, the Premier mentioned 150 or so people in hospital at the moment and 10 in ICU.
Mm-hmm. So we have just over 360 in public hospital beds today. I can get you the exact figure, but just over 360 today. So we're slowly seeing that come down, but it's still higher than at the bottom of the first wave for COVID patients. And we do have sadly, a couple of patients who are in ICU who are co-infected, so they've got COVID and influenza A. So it can be very, very serious, which is why we're recommending people still go out and get those boosters as well.
And the 400 to 500 admissions that you projected, so that's when?
That's just in the next 2 weeks. We think, based on the data for admissions in 2017, that how quickly it escalated, we could be looking at 400 to 500 beds within the next 2 to 3 weeks. And that is not the peak of 2017, but that's just how quickly we can go from where we are now to that many beds just in the next 2 to 3 weeks, which is why we're acting so decisively now that we've seen the data over the last week of how quickly these cases are increasing.
Is there any modelling on how many cases we might be able to prevent by having people come and get these free vaccinations?
I would expect hundreds of thousands of cases if people... We know flu shot works. We know flu vaccine works. That's why so many people over past years come out and get flu vaccinated. But we know there is vaccine fatigue, and I was concerned, and certainly the Premier was very concerned, that a family of 4 two teenagers and the parents thinking about going and get a flu vaccine right now would be paying, you know, $160 plus. I don't want anyone making the decision of not getting a flu shot this year because they can't afford it. We just can't afford that on our health system, and we can't afford that on our economy. So this is helping businesses just as much as it is helping our health system and our health workforce who are, you know, tired. And if you can't think of any other reason to do it for the doctors and nurses who are working in our EDs and our hospitals. We owe it to them to try to keep people out of our hospital system by going and getting vaccinated. So we will, they're working on that strategy this week, and it will be dependent on where we see the demand. So we'll only initiate that when it is needed and where it's needed. So, but we have a lot of those facilities already in place.
Is there any idea where we could see this peak beyond that next 3-4 weeks?
We just can't be sure. Like 2017, as I said, 2/3 of those cases in Queensland were influenza A. This year, we're looking at 98% influenza A. So we don't know what our peak's going to be. It's more equivalent to swine flu, I'm hearing, from 10 years ago. So we can't be sure. But what we do know is it'll certainly be lower if a large proportion of the population go out and get vaccinated in the next couple of weeks. So that is our priority right now. That's what our advertising campaign will be focused on. And when you look at that graph, those 10 to 39-year-olds, I've already texted my children over the weekend and said, go get your flu shot. Any parent out there with a young adult child should be encouraging them to go get their flu vaccination.
Sorry, I can't remember if you said or not. Has anyone died from the flu this year?
I'll have to confirm that.
Minister, just on another issue, the QC evaluation into the GTI trial found that pharmacists had a preference still to be prescribing antibiotics. Given that, will this trial be made permanent?
That report hasn't been released publicly yet. That briefs with me currently, and I'm considering the recommendations around it. So we'll have more to say about that shortly.
You've read the report?
I have read the report, yes. But I'm not going to comment on a report that hasn't been publicly released yet, so I'll do that. We're consulting with stakeholders now on all of that.
On the flu, are you concerned that GPs still aren't seeing people with flu symptoms and therefore they're still going to hospital EDs and from out EDs? Is that still...
Look, I'll leave that to the AMA to comment on that as well. But I know the challenges that doctors have had with COVID as well. But we all need to work together. We know the whole health system's under a lot of pressure right now, including our GPs right across the state. We need everyone doing their part, and I have no doubt with the GPs when people are coming in unwell that we'll be testing for influenza A at our GP level as well. And really our acute fever clinics, our flu clinics will be the sort of backup to that as well. So.
Can I ask you about emissions reduction target 2030? Queensland is 30%, which is 13 percentage points lower than the federal Labor government now. Are you going to increase that given the message that was sent to the federal election that people want more action?
Well, let me say a few things. First of all, can I congratulate Anthony Albanese as being sworn in as Labor Prime Minister. This is great news, a person who will unite the country. I think we had an opportunity during COVID for the whole country to be united, and instead it was divided, and that was unfortunate. So I think now what we will see is a federal Labor government wanting to bring the states and territories together and to be able to put key national issues and state issues on the agenda and have a very constructive dialogue and to get good outcomes. And that's been something that's been lacking over the last few years. In relation to the environment, Labor has always had a very clear environmental progressive policy. We were, from my memory, one of the first states to actually put in place an electric charging superhighway. We've got rebates for electric vehicles. We've got a $2 billion renewable energy fund. We are absolutely focused on adding to our national estate. So this is what a progressive Labor government does at the state level, and I think what you will see now is a progressive federal government that actually realises that climate change and the environment are important to every single Australian. Farmers, businesses, they've been acting on climate change for years. And unfortunately, the former federal government did not embrace what the community was talking about, thinking and saying. And hopefully now, we will have more dialogue in our media outlets as well, talking about what people want.
But will you be reviewing the target?
We have a clear target and we'll continue to focus on it.
Were you surprised at the support for the Greens at this election and disappointed that Labor didn't pick up Warren's primary vote?
Well, we saw some swings to Labor in Queensland, which was great, and some of our sitting members actually increased their swings, which was fantastic to see. Queensland's a big state. I think people can see the difference between state and federal elections, but in relation to we did see some Green candidates get elected, but also too, we're still unsure yet about what's going to happen in the seat of Brisbane, and hopefully Madonna Jarrett will be elected there, but they're still counting underway, so I don't want to preempt that. I think what we also saw was a lack of ability of the former federal government to understand the issues impacting on women, which as a female leader of a state, issues concerning domestic and family violence, equality on boards, equality of pay for women. You know, these are real issues. The treatment of women, sexual harassment, domestic and family violence. You know, I think the former LNP government failed to understand that these are issues that matter to women in all walks of life. And I think we saw that especially in New South Wales and in Victoria, in the inner seats. But what we do have now is a breath of fresh air. It is just fantastic to see Anthony Albanese elected, and I look absolutely forward to working with him.
How is State Labor going to combat the growing support for the Greens at the 2024 election?
Like I said, we have a very progressive environment agenda and we have a very progressive jobs agenda. We are growing the economy. We recognise that we have traditional industries and we have emerging new industries. And my government will always focus on jobs. And I know that Anthony also wants to focus on jobs as well.
Will the government be extending the coal road increase in next month's budget?
They're matters for the Treasurer.
Is State Labor at risk of losing more inner city seats to the Greens? Is that something that happens in councils? And what lessons will Labor take from the city of Brisbane?
Well, people thought that was going to happen in the last state election and it didn't happen. So there was one extra Green from memory added to the state parliament. But I think what this is, there is a mood out there for governments to listen. And I hold myself up to out there talking to people all the time. And you really need to be in touch with what's happening. And you need to understand there are cost of living pressures, which is why today there is, you know, we want to make sure that families get this flu injection so they don't end up in hospital. Like, look at the charts over here. I don't want to see families in hospital, kids. This is particularly having a bad impact on children. So, you know, we want to make sure that our children looked after and our elderly. So let's get people vaccinated.
What the 50-50 health split would become a reality over the
Well, I'm looking forward to the first face-to-face National Cabinet meeting with the Prime Minister and all the other leaders of the states and territories. It is something that is front and centre. It was front and centre of the previous National Cabinet, and the Prime Minister, the former Prime Minister, would not even allow it to be on the agenda to be discussed. All of the health ministers wanted to talk about it. It is the biggest pressure point across Australia, and it's something that, you know, we need to sit down and have a real conversation about. And, you know, we've had 2 years of COVID, we've had upheaval to people's lives, and we've had people in hospital, still in hospital with COVID. Tragically, we still have people passing away from COVID. But this has, and we've got fatigue of our workforce, and I can say to the people of this state, I am absolutely focused on health, and there will be a significant injection of health funding in this budget.
Long-term, both major parties are continuing to hemorrhage votes. Does Labor, can these parties look at what's done in Brisbane, particularly in the city of Griffith, and the way that they connected with voters, knocking on doors?
I'll say this to you. Our sitting members increased their vote. And I know hard-working campaigners from the top of my head, like Milton Dick and Annika Wells, very, very good local campaigners. Shane Newman, they're all out there, always speaking to voters, door-knocking, community campaigning, listening, responding. But I do think that the public is sick and tired of the adversarial nature that comes from the two major parties, and they want a government that looks after them and their families. They actually want people to understand their issues, be in touch with their issues, and they're the people who will get elected. So it's a lesson for everybody in politics.
So do you think that surge in the Greens and the Teal independence is a way forward for those parties?
Well, what I'm going to say to you there is I know that my members in the inner city, those inner city seats, they're hard-working local members. They're in touch with their local communities. And don't forget, there was a Liberal Party person who lost their seat, and there was a Labor person who lost their seat. And it's a lesson for everyone to be in touch with what's happening in their local communities. I just think that people need to be really aware of the issues that are in their local community. I think Terry Butler worked very hard, but obviously in this case, there was a more structured, maybe a more structured campaign.
Queensland was snubbed.
A couple more, then I might have to go if that's right to caucus.
We know in terms of the federal budget in previous years, Queensland really has been left off the list when it comes to funding for major projects and road upgrades. Do you think now that it's a Labor government?
Well, it's a very good point, because it was our government that funded 100% of Cross River Rail, because the federal government, the federal LNP government, played politics with the biggest transformational project of our city, an underground that is now going to be connected to brand new stations, brand new precincts, and help serve our Olympics as well. You need governments to work together in the best interests of their community. So that's something that I will continue to do.
You mentioned you've spoken to
Last one.
the government, you've spoken to the Prime Minister. What are the key issues that you raised?
I've just mentioned about the National Cabinet and face-to-face meeting as soon as possible, and congratulate him.
Do you also take from the Greens and Teal vote that integrity is very important to people as well?
Well, there is no federal ICAC. Okay, there's a Triple C here, and most other state jurisdictions have an independent anti-corruption watchdog, and the federal government failed to recognise that the community want a federal ICAC, and they campaigned on that. Yeah. Okay. Thanks everyone.